Spinal Truth Show, weekly podcast edition. I'm your host, Dr. Caleb Slater. Today, joined by Danielle Slater, an expert women's health physical therapist and my wife. But today, she's not here as an expert physical therapist. She's here as a patient to share her story of what she went through during a time where she had some trauma, physical trauma, and what she saw in the healthcare system.
Yes, thanks for having me again.
So to kind of set the stage, I think we were 25-ish, 26, something like that. So It's about 14 years ago. And we were in the Grand Canyon and we were cliff jumping. And you were struggling a little bit with how to cliff jump. So we practiced.
It was more like nerves. Being up, what do you think that was, 50 feet?
Well, but we practiced at 10 feet.
We did practice at 10 feet on a little baby jump, but and to set the stage, like we walked maybe 3 miles, at least an hour from the main campsite,
camp area,
which was really desolate regardless. Like there's just a tribe of people who live there year round, but you have no other resources there.
There's nothing around.
You're really in the middle of nowhere.
So we're in the Havasupai Falls camping. We had to walk about, I think it's about 12 miles down. Then you camp, and then we had to walk about a few miles to get to the waterfalls and to the area where we were cliff jumping.
Yeah, we were just exploring. We didn't know it would be there. We stumbled upon it looked like a high school senior group of maybe like 10, 20 people doing this jump.
Right. So
we're like, that looks fun.
So we did it too.
But I'm up there like shaking. Like this is nerve-wracking.
It was a 50-foot jump, and the 50 feet felt a lot higher when you're up there.
Oh, yeah.
Than when you were down at the bottom watching.
Yeah.
But what ended up happening is you jumped and you landed on your ass.
Well, to be fair, there was like a rock that was along the ledge, and I had to clear it.
You had to jump
so that
out.
It hit the rock.
So it wasn't an easy jump. It wasn't like you were just kind of falling down. You had to jump out, clear the death rock.
And in jumping out, I forgot the idea of penciling.
Which is the main idea, by the way.
So I went into the water in a sitting position.
Long sitting position. Your
which
legs
is
are out.
A big mistake.
Big mistake.
Yeah.
And the second you hit, my first thought was burst fracture.
Yeah, you were up top. Like you had done it. You came back up, and then you were there to watch me, and you were going to do it again at that point. But instant wind knocked out of me. Once I got up, I was really disoriented and trouble making it to.
Yes, that's true.
Like figuring out what to do.
So you got out, and then, like what you said, we were miles away from camp, and then at camp we were 12 miles away from our car. So you got out, you were okay, you were able to get back, and that 3 miles back to camp involved some climbing too.
I still remember pain. We slowed it down. I was uncomfortable.
I have never seen a larger area of bruise than the entire of your back of your legs and your ass.
Oh yeah, black and blue.
I mean, it was a deep purple, black. You camped that night.
We had to.
It
really wasn't, unless we were gonna it wasn't at the point I needed to medevac out. I was just very uncomfortable.
Well, there are no neurological signs, thankfully, so not a burst fracture. The long story short, you ended up with a few compression fractures.
Yeah.
And for the people at home, compression fractures, they're more common in a few areas of your spine, the transitional areas of your spine. So where you go from one curvature to another. So you go from lordosis to a kyphosis, or so you go from like a C to a reverse C. And that one of the main areas is your TL junction, where your thoracic spine meets your lumbar spine, so kind of your upper, lower back.
Which is right where, I think it was T9, 10, and 11.
And I think you had a few actually in the upper thoracic as well too. But anyway, so camped. The next day you hiked out, you were a champ, 12 miles.
Oh my gosh, and we were not supposed to leave that day. We were supposed to hang out that day, but I think I was uncomfortable.
Yeah.
And so late morning, we're like, all right, we're gonna go, which was a stupid idea. We're in, Grand Canyon is hot. This is summer.
We left at noon because you were so uncomfortable. We were gonna wait until it cooled down, and that was a mistake.
Yeah, we almost did not make it back.
That was rough.
Yeah.
So we got back to the car, you rested for a day at Sunday, and then you went to work on Monday.
Yes.
But you still had symptoms. Can you remember what your symptoms were?
I remember just any kind of, getting in and out of bed would hurt, standing up would hurt, bending would hurt. Like any movement that involved moving my back was uncomfortable, and then I would just be sore just being in a position for a while.
How long until we went and got some form of imaging?
Oh, that week.
That week?
That week.
Okay.
I was that time a PT in like a skilled nursing facility where we had like patients coming in after maybe like knee replacements, back surgeries, and then residents who live there. So I had to help them with like transfers and lifting, and I just even remember having to tell my boss like, shoot, I can't lift anyone right now.
Sure.
I'm just like surviving moving. So it was challenging.
And so we got x-rays and then we got an MRI, right?
Yeah, and then I made an appointment. Oh, the orthopedist said, why don't you see a neurologist, just to make sure.
And what was the information that you got at that appointment?
The neurologist told me that he would not recommend me running anymore. And at this point, I had done cross country in high school and college. Like I loved doing 5Ks. Running was my outlet of stress. Enjoyed it. Ran most days. So to be told like one of your favorite activities because of your status of your back, you should not do anymore. I was, of course, like upset. I didn't want that to be the case, but also respectful that someone's telling me, hey.
And we want to set kind of the ground, the foundation for this. We're both new grad physical therapists, so we know more than the general population in regards of your spine, your health, stuff like that, but not a lot still. And at that time, what the doctor says was kind of the final, like the buck stops there, right? Like whatever the doctor's recommendation, that's for all intents and purposes, that's law. And we took it as that at that time, briefly, and we, just like anybody else out there would, just like any person off of the street, any person with not medical training, if the doctor tells you something, you're going to listen to it. I feel, again, in those 14, 15 years since this time, the pendulum swung a little bit, and now it's more commonplace to question the word of a doctor, get a second opinion, obviously look stuff up, ChatGPT, Google, stuff like that.
Go off your symptoms, too.
Go off your symptoms, but again, as a layperson, if the doctor tells you something, you don't really have the ability to refute it. Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference. And this doctor was telling you without any neurological symptoms that you would never run again at the age of 25, or you never should run again. And that was really disconcerting for you because running was like what you said, that was your stress outlet, that was your exercise, that was your hobby.
And with the amount of like pain and discomfort and trauma that I saw on an X-ray and MRI, at that point I kind of accepted it.
You could be talked into it.
Right, that, all right, I need to like reframe what I'm gonna do in the future.
Well, and to kind of quickly fast forward here a little bit, how many marathons have you run since then?
2.
2.
Yes.
And relatively recently too, right?
Yeah, my last one was actually just 2 years ago from now, and I still remember it was probably about a year at that point of just trying to modify my activity. I remember like, all right, well, I'll go on the treadmill and I'll put it on incline and I'll get a good workout doing that and I'll walk. And then slowly and slowly, I'm like, I'm feeling good. And like I would take a few jog steps and I'd be like, I feel good. And to the point where I started a little bit of running, a little bit more running and no symptoms. And at that point, like my back I wasn't having issues. I recovered, I rehabbed it.
And how long did it take until you got back to running?
I think I was scared to start, so longer than maybe it had to be, but about a year.
Okay. And the reason we kind of bring this up is we were talking about this the other day, that if you didn't have that persevering mentality, right? If we didn't have some medical training, medical knowledge to know what to look for, that meant bad symptoms, stop, okay symptoms, keep going. There's a large chance that a lot of your life, a lot of the last 14, 15 years would have looked a lot differently. That you would have, you can see how easy it would have been to become your symptoms. Because for about a year, I remember this distinctively, that you were actually running before getting out of bed wasn't painful. So the last thing to come back was rolling out of bed for you. Rolling and twisting was still the last painful thing for you, and you were back to running. But it would be pretty easy for anybody out there to say, hey, my orthopedist, my neurologist said I should never run again. And then that lack of movement starts to snowball, starts to, however you want to picture it, weight gain, stiffness, muscle mass deterioration. And in the female population, bone density is a big issue. Not weight bearing, not putting load through your spine, through your joints can become it's typically a bigger issue than for men.
Yeah, and even for me, it was stress relief. Like there were so many benefits because I enjoyed it. One of those rare people who enjoys running.
A lot of people out there are weird and like running.
Yeah.
Yeah, I don't get it.
You just can't. You're not a part of that group.
No, I am not.
Not at all.
I wish the doctor would have prescribed no running for me.
Yeah, I bet you do.
But so and again, we look at this now from a clinician perspective, where we see this all the time, that patients are getting told that they have a condition. And this condition, a lot of times, is there regardless of whether or not they had any trauma, probably regardless of their symptoms, but they're getting imaging, they're getting a diagnosis, they're told degenerative disc disease, herniations, spinal stenosis, facet arthritis, whatever. And now they start to act like their disease. They start to act like their imaging or their label. And now I can't lift this. I can't go to the gym. I can't go for a walk. I can't help you move this because of my problem. And it just slowly starts to compound on itself until it becomes debilitating.
Yeah, it's not like ongoing assessing your symptoms and seeing how you feel and what you can do. It's just kind of blindly following a small snapshot in time of someone's concern. So a lot of activities get taken away at the moment, which maybe in the future you'd be able to return to, but you're right, you become that diagnosis. And I even think it translates into being told you're a great candidate for the surgery. Again, see so many people we've come across who've had surgeries that didn't improve the symptoms they were hoping they would. And it's really unfortunate. But
I would say, specifically talking about the spine, I would say the majority of people.
It's following the direction of someone who's out there to try to help you, but we're complicated, right? People are so complicated that there's no easy fix, and we all want the easy fix. I was waiting for that neurologist to say maybe he was going to do, at that point,
kyphoplasty.
Yeah,
right.
Some kind of procedure to heal and fix my spine. And that's what, in my concept, my mind, that I thought at that point would have been helpful.
And And kind of taking a little bit closer of a look on that, where, you're saying that they're out there trying to help you, and you're absolutely right. And I'm not trying to throw any, shade on this neurologist. But it's a quick meeting. How long were we there for?
15 minutes.
15 minutes. 15 minutes to diagnose you and then give you lifelong advice. And I would say 15 minutes is probably more than most people get during those meetings, right? And also, they have to speak within their own breadth of knowledge as well as medical safety, right? So they have to err on the side of caution, which makes sense. But you need to understand this, that they don't want to get sued, right? And so it's not even just medical, physical caution, health-related caution, it's legal caution. So if they said, you asked the question, can I run? They say yes, you go run, and then something happens, you're going to blame the doctor, right? And
that's a lot of pressure.
Yeah, and it is a lot of pressure, and it's a really tough situation to be in. But I think as a patient, I think you have to understand the situation that your doctor is in. They have a limited amount of time with you, largely based on, the way insurance has changed medical practice. You go from, it used to be a doctor would come to your house, and then while they're there, they'd also look at any family members, and they'd know your name, and they only service a certain amount of people, to now you go there, you don't see the doctor until the very end of your visit. If you do, you see it for 3 to 5 minutes for the most part, and they largely diagnose you based off of imaging or what's written in the chart versus who you are, how you move, maybe what your symptoms are, especially your symptoms with movement. So they don't get a full picture of it, and their tools then in that limited capacity of time is medication, injections, or telling you to go somewhere else, go to physical therapy, and if that doesn't work, the next tool is surgery. And this isn't a good system, and it's created a lot of pacification, numbing of your symptoms.
Yeah, and that's even if they tell you to go to physical therapy. Sometimes the jump to surgery is quick, and for a patient it might sound simple. They don't have to do anything but show up.
Well, let me ask you this.
Realize.
If that doctor said you need surgery to fix this,
I probably would have
gotten it. Yeah.
Been like, my body's broken. You have something to do that could fix it. I'm so glad I didn't go down any of those routes. Like I have no limitations. Like just like you said, I just ran a marathon. How many years later? I'm not physically.
After having 2 children.
Yeah.
Having 2 children, you go to workout
physically
classes.
Active. I don't think from that injury that I'm physically impaired in one aspect at this point. That I can really appreciate now. Your body has a tremendous ability to heal if you do the right things. You give it some time.
And maybe that's kind of the point of what we're trying to get to here is that a lot of people are told that they have a problem. That problem, we've talked about this on other podcasts and talked about it often. The problem specifically seen on imaging, herniations, disc degeneration, spinal stenosis, stuff like that. Those are very, very common findings in people who have no pain whatsoever.
I'm sure I have plenty of that stuff going on. And I'm sure if you took an image right now, I still have evidence of a compression fracture. It's not like it just heals and the bone's all better.
There's probably some height loss.
Oh yeah, actually. Now one of our 12-year-old daughter's friends is now taller than me. And she says she's the same height as me, but when we compare back to back.
Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show. So what do you do if you're a layperson? What do you do if you have no medical training? Because like what we're saying, we had medical training, and we, at that time, being new grads, we would have absolutely followed the doctor's advice relatively blindly.
I think it's tough, but I think you respect the information, but you have to also look to doing conservative measures for as long as you can and see what healing can occur.
I think not giving in to your condition as best as possible. And I know that sounds so easy to say, but when you're out there suffering, you want relief, you maybe even need relief before you can do anything. But sometimes that relief that you're seeking, the injections, the pills, they basically do nothing. They numb your symptoms and they pass the buck down the road to where once they wear off, you are now worse than what you were before because you were doing movements that were painful or positioning that was painful and you didn't realize it. And your condition has not been addressed, but has continued to deteriorate during that time that you couldn't feel your symptoms. So maybe getting a second opinion or seeing somebody outside of the specific field that you were working in. There's been a big shift to functional medicine these days, where a lot of people are going to not a primary, but a functional doctor.
Yeah, it's kind of a nice appreciation that there's new practices in medicine that are more open to looking at
look a little bit differently.
Yeah,
right?
A little different lens. And
I think that different lens is needed, to be honest. Again, talking about just the medical system as a whole and maybe the orthopedic aspect of it is that we can talk to more specifically. You have a 3 to 5 minute appointment where you're largely diagnosed based off of your imaging. Something needs to be done because that's not proper medical attention. That's not proper evaluation, diagnosis. You have an inability to give, true guidance in that limited time frame. The first session that I do with anybody, it's an hour, and I'm looking at so many things. I'm asking so many questions, and then I'm spending a lot of time telling the patient what to do, what to expect, what means good, keep going, what means bad. Hey, this symptom it likely means you're getting worse. If you see this,
Yeah, you're fatigued after one of those sessions. That's a lot of talking.
My voice is tired after, and that's the way it should be. That's what we need, and that's not what we have. And I honestly don't know how to get from point A to point B. I don't know how to reverse it, other than you need to kind of siphon off or as a clinician, and now you're treating probably outside of insurance-based medicine. So now you're limited to only being able to see this doctor that can give you time if you have enough money. And that's frustrating.
It's frustrating.
So what would you tell people out there that, that you learned from this?
Yeah, I feel like this was a great experience to just appreciate that there are limitations in the medical field and advice given, because every person and diagnosis and circumstances are really unique. So maybe extensive compression fractures in one person at a certain age or with a certain history, and who maybe is not athletically already interested, wouldn't end up running. That wouldn't be in the cards for them. But in my case, even though I was told that really was inaccurate advice, because there's no reason why I should have been limited from a future of that activity. So be cautious in the information that you're given. Really continue to be open so that your body can heal and repair, and you do the right things. Your future may be different than what you're being told.
I would argue that a lot of people, the pain that they're in isn't from what they've done, but it's from what they're not doing anymore. It's from the lack of movement. It's from sitting.
The muscle atrophy.
It's muscle atrophy. It causes pain. It's just loading a joint in a certain range over and over and over again. Us sitting, leaning forward, constantly compressing the front aspect of our vertebral bodies, right? Of our spine, let's say, is constantly stretching the muscles, tendons, ligaments, fascia in the back. We're constantly loading them in one specific direction over and over and over again. That causes pain. To think about this at home, take your finger and just bend it back until it kind of hurts. Maybe even bend it back until it doesn't hurt right before it does. But now keep it there for 10 minutes. Then you let go, your finger will be stiff. It'll be hard to make a fist again. And that's what a lot of people out there are experiencing, but then we get the pain misappropriated to our image findings versus our lifestyle. And your body has a great ability to heal. You just have to know how to move it, how to contract it.
That movement's important.
Yeah. And with a lot of advice out there currently, and it does feel like it's changing a little bit. It does feel like the pendulum's swinging back a little bit. But for the large majority, especially spinal-related advice, it's protect it, guard it. Don't move it. Don't bend forward. Don't bend back. Don't twist. And for a long time, as clinicians, we practice this way. Patients that would come in with back pain, the treatments out there, everybody knows the exercises. It's, bird dog and planks and dying bug and dead bug and clamshells and multifidus. It's everything neutral, everything very light to little resistance.
That's not normal body movement in your life.
It's teaching people how to log roll to sit up correctly, right? Yeah. Instead of figuring out how to make their spine move and strong, healthy enough, stable enough that they can get up like a quote-unquote normal person.
It's hard because for so long now that's been the preached method by so many people that when you try to differentiate from that path, people have a hard time understanding that.
Yeah, and I get it. And again, I always try to be fair for, what do you think, close to 7 years of our career, we practice this way, and maybe even still after that 7 years, often we still added a lot of those core neutral stability components. But we were seeing what I'm sure other people out there as patients were seeing is that those aren't techniques to get you better. Those are techniques to keep you from basically to manage, Band-Aid or kind of support your back, but not make it strong.
I feel like they were a safety net of things that
cautious.
Maybe don't upset the back in the moment, but do they do much to allow you to get back to normal function? No. Because we don't function in if you could imagine, if you were like in a brace that didn't allow you to bend, extend, or move, that we don't wear something like that and just function like that. We have to all the time.
No, but that's the way it's practiced now, and it's upsetting because, and again, trying to be as fair as possible, we did this, but now looking at it through a different lens, if you said about your knee, and I said to you should never straighten your knee again, or never bend it again, either way, that you need to protect it as much as possible. Would that make sense?
It would kick you.
Yeah.
That's bad advice.
That's bad advice. But why is that good advice for your spine?
It's horrible. That your spine has many more joints of movement that need to move.
Yeah. Yeah, your knee is a simple hinge joint, for the most part. It opens and closes and
so many. How many joints are in the spine? Is it over 100 articulations? It's a lot.
Yeah.
Right? With little facets here and
rib articulations.
Yeah, it's massive. You need movement there.
That's what it's built for: movement and load absorption, right? And again, just sharing this story that even as clinicians, we would have gone down this wrong path, and if it not for your maybe at the time stubbornness.
Yeah.
Just will to get back to your previous lifestyle. Well, so that's our show for today. I hope sharing this story gives a little bit of insight into maybe the medical system, maybe some of the information that you're getting, and to empowers you to continue to look for something. If you don't feel like it's right, if you don't feel like you're getting the right information, if you feel like there might be something else out there, trust your gut. Like what my wife said, you need to listen to medical advice. You need to hear it, but don't take it as a fact. Ask somebody else. Get a second opinion. Look up online. If you're getting told something and it doesn't feel right, it probably isn't.
Yeah, you are not your diagnosis.
You have to be careful about becoming your diagnosis, and it's harder than it sounds to avoid. So I definitely get that, but becoming your diagnosis, now it penetrates your life. All right, well, that's our show. Make sure to like and follow us on Instagram, YouTube, Facebook. If you have specific questions that you'd like to ask, you can do so at info@thespinaltruth.com. If you'd like to schedule a consult or a session, thespinaltruth.com. We'll go over your symptoms and we'll give you the best advice we can. See you next week.